Box 8 is how to help patients with mental health conditions. So I label box 8 as helping with mental health. And with the distribution of questions out of the 230 and the percentages, I'm going to expect about 12 questions. That's 12 to 13. So this is where I'm going to look at how am I going to select mental health medications like SSRIs, like antipsychotics. When am I going to use first-line antipsychotics? When am I going to use second-line antipsychotics? When am I going to augment antipsychotic use? When am I going to change from a particular SSRI to a particular SSRI to another SSRI, or from SSRI to SNRI? And if I'm switching, how do I switch? When am I going to use a MAO inhibitor, for example? Okay, when am I going to use psychotherapy? When am I going to refer a patient to substance use programs? So what am I going to study in box 8? Initial therapy versus pharmacological interventions. So for example, a patient comes in with a particular mental health condition. Am I going to refer to CBT first? Am I going to do interpersonal therapy first? Am I going to do family therapy? Before I go into pharmacological treatment? What about harm reduction principles? So this is where I'm going to learn, my opioid use disorder, right? And how I'm going to manage a patient. I'm going to use methadone, Suboxone, Sublocade, and other medications we can give to support patients with, for example, opioid use disorder, like clonidine, like metazapine for their sleep, like Tylenol, like Advil, like, all these other medications. And as well, crisis intervention plans. So I have a patient who is actively suicidal. What's my next best step? So what are my tactics for this particular box 8? I need to know mental health medications. I also need to know when I am not going to prescribe medications. And some unique medications, I need to know which labs will I do for those medications. And I also need to learn how to prioritize safety planning.